What's wrong with Michael? The answer might surprise you. 9 out of 10 kids in America are experiencing one or more of these problems every day. They seem to be totally random, with nothing in common. However, research over the past 20 years has linked each of these symptoms to a common cause. Children's sleep-related breathing disorder, commonly called SDB, reduces the amount of oxygen that a child's brain and body receive during sleep. They don't get the kind of restorative sleep that a growing child needs, and they end up chronically tired. There are 2 kinds of sleep-related breathing disorders. Type 1 SDB involves the airway in the child's throat. Blockage of the airway in the child's throat results from the tongue and lower jaw not getting enough of a workout in the first 5 years of the child's development. Many parents wean their child onto soft and pureed baby foods. However, mushy baby foods don't require the child to chew. That tricks the child's developing lower jaw and tongue into thinking they are not needed. The jaw and tongue don't grow and may, in fact, shrink while the rest of the head continues to grow normally. The face takes on a distinctive receding chin look as the lower jaw and the tongue don't keep up with the growth of the rest of the face. This is an actual patient's X-ray at 8 years of age. Notice how the tongue and jaw are constricting the airway because the lower jaw didn't grow forward enough to keep the airway of the throat open? Now, let's discuss type 2 SDB, the blockage of the child's nasal airway. The child's cheeks and lips are powerful muscles, and they are constantly contracting and squeezing. That continual pressure can squeeze the upper jaw together and force the roof of the mouth upward into the nasal airways. If the tongue is living in the roof of the mouth, it counteracts this relentless force by pushing outward. However, if the child has a weak tongue, it may not be up to the job because it's resting on the floor of the mouth. Do you see the problem in all of these photos of sleeping children? That's right, their tongues are lying on the floor of their open mouths because it's hard for them to get oxygen through their noses. But that allows the cheeks and lips to continue squeezing the upper palate upward all night. Then, when the child wakes up, they get a bottle, and when they're done with the bottle, they get a pacifier to suck on. Why is this a problem? In this illustration, the red circle represents a bottle nipple or pacifier. As the child sucks, the tongue pushes the object into the roof of the mouth. The roof of the mouth is then forced up into the nasal airways, making them smaller and smaller over time. Additionally, the act of sucking pulls the cheeks and lips inward, which squeezes the upper jaw together, making incoming teeth fight for precious space. Before parents start blaming themselves for causing their child's breathing problems, it wasn't until very recently that the connection between the reduced oxygen flow to the brain and body caused by children's SDB was connected to all of the social, physical, and behavioral problems affecting children today. It turns out that baby food, bottle nipples, and pacifiers are manufacturing children with significant sleep issues who eventually become, if not treated, adults with significant sleep issues. But that's okay, because I have good news. A qualified sleep medicine professional can offer a treatment program which can not only stop but actually reverse the damage done to the child's airway and to the child's facial structure. It's called Guided Growth. Guided Growth is a do-over program for kids and their parents. Remember the X-ray of the 8-year-old boy with a receding chin? Here he is at 13 years of age after following a guided growth program. His facial structure has become normal for his age, and the boy's airway has been opened by moving the lower jaw forward. How do you know if your child has a sleep-related breathing disorder? There are a few common signs of SDB. Snoring and/or sleep apnea episodes, crowded or crooked teeth, dark circles under their eyes, irritated or swollen tonsils, a receding chin or an overbite, 24/7 mouth breathing. If you suspect that your child has sleep-disordered breathing, call our office for an evaluation appointment. The sooner we start treatment, the sooner your child can start living a normal and happier life.